Hello, everyone. Welcome today to the Hope for HS event. My name is Angela Dresselhaus, and I am one of the organizers of online meetings, and I'm also serving as a community lead for the North Carolina chapter of Hope for HS. Hope for HS is an all-volunteer, grassroots, patient and caregiver-directed nonprofit organization, and we've been advocating for those with HS since 2013. So we have a public Facebook page that's open to anyone. If you have HS or you are an immediate caregiver of someone with HS, you can join our private Facebook group. You can also visit our website at hopeforhs.org to learn more about us in general and our upcoming meetings. So today we're very happy to have Dr. Lev-Tov here today, and he is an assistant professor at the University of Miami, Department of Dermatology and Cutaneous Surgery, and he's an expert in HS and wound care. So he also serves as a treasurer of the HS Foundation and is involved in the Miami chapter of Hope for HS. So today he's going to talk to us and share his expertise in the area of wound care. And we'll be taking questions from the chat. So if you have any chat or any questions, please put those in the chat. And we have two med students with us today who will be moderating chat and the Q&A and help read some of those questions. So I'm very happy to turn the presentation over to Dr. Lev-Tov.
Hi, everyone. Good afternoon, or wherever you are in the world, good morning or good evening. My name is Lev-Tov. I'm a dermatologist by training, and I work at the University of Miami. I do two main things in my career. One is take care of people with wounds, and then take care of people with Hidradenitis Suppurativa, or HS for short, which is how I'll refer to it during this presentation. You know, first I want to say that I want to thank you for joining us. I think if this is the first time you're joining one of the Hope for HS activities, don't stop. Most of my patients really value this kind of activity. There are other forums, but certainly connecting with other patients is really empowering, because the reality of it is that we don't have perfect treatments for this condition. And so part of what we do as part of the healing is connecting as a community. And so with that in mind, I want to thank Angela and Athena and Angie and everybody who's working so hard on this on your behalf. It's just been an amazing, for me, a privilege to view this group kind of working and making real difference in people's lives. So thank you for Hope for HS on behalf of my patients and myself as a physician. So I started saying I take care of the two main populations, both as a dermatologist. I take care of people with all kinds of skin conditions. And at the University of Miami, we have a lot of expertise in wound healing. We do a lot of research in wound healing, laboratory research, and what we call translational research, which means we go back from the lab to the patient, from the patient to the lab, and kind of try to figure out what would work best. And so, as part of that, you know, as the years go by, I've seen a lot of patients suffer with HS, and what I'm trying to do is make that connection. And before we get started, I do want to make sure that we're clear that even though I'm a doctor, whatever I'm going to say here is not to replace your conversation with your own doctor or caregiver, okay? It's very important that you have someone who knows you, who understands you. Taking care of patients, it's not a formula. Every person is different, and you try to figure out what's best for that person in front of you at that time. So I don't want you to think that, okay, Dr. Lev-Tov said this dressing goes in that, and that's it. No, there's room for variability, as you probably know. And when we talk about HS, probably one of the things I tell my patients and tell other doctors when I lecture to other doctors is that HS is a different disease for a different person on every different day. And so that's why one dressing is not going to solve the problem. So that's a key takeaway, I think, that you should keep in your mind. And I'll tell you a little bit about the research that we're doing on that to help the community understand this point. But the disease is different every day, and every day it may require a different type of dressing, sometimes no dressing at all. And I think you probably know this better than I do. So when I think about wound care for HS, the first thing I think about, and that goes back to my point about talking to a doctor, is that the only way to really take care of the wounds that we deal with HS, or the wound care issue in general, is to really take care of the disease itself. And so I really encourage you to seek out a dermatologist near you, develop a relationship. It takes time to get the results, but results are doable. And we do have an ongoing growing toolbox of tools that we can use in HS. And so when I say take care of HS, what do I mean? I mean that you see a doctor, you get together with a group of patients like Hope4HS, because you need help both for the psychological aspect of HS, which doesn't necessarily mean a psychiatrist or medication, just means somebody you can talk to and kind of share burden and maybe get some tips. And so the psychosocial part of what we call that, which means how you take care of yourself, the day-to-day of stuff, and the effect it has on your ability to function in the day-to-day, that is a key part of what you should do, and talk to your physician, but also talk to your peers. And then there is the medical care, which is usually the medication. So when we think about that, there are medications that we can prescribe. There's also treatments that you can do by changing some lifestyle. We know that there's some association with smoking. It doesn't mean that everybody that smokes has HS, and it doesn't mean that everybody that has HS smokes. But when you look at the two groups, you see a lot of overlap. So we call it an association. And so people who have stopped smoking just generally reduce the inflammation in their body. And so we think that it's going to help their disease. And there's some literature that supports that. So for me as a doctor, it's a very easy recommendation to make. Hey, don't smoke. It's not good for you, not just HS in general. Same goes for weight loss. That's another recommendation that's not a drug, but is part of your medical care. And again, here we have an association. So not everybody who's overweight or obese has HS, and not everybody with HS is overweight or obese. In fact, I have many patients who are very, very thin, almost dangerously thin. So I don't want you to think of that as 100%. It's just there's some overlap, and so we see an association. So we try to tell our patients. And these things are super hard to do, right? Same goes for some nutrition. We don't have great nutritional advice in HS just yet, but we are trying to develop some data on this. But we think that keeping a healthy, balanced diet is probably a good way to start. There's some light evidence for anti-inflammatory diets and such, but this is beyond the scope of this talk. Suffice it to say that healthy, balanced diet with not a lot of sugars is part of your overall medical care for HS. And then there's the medications that your doctor will prescribe for you. And when we think about medications, there are a few categories. Broadly, I'll just review for you, because you all have been probably given antibiotics, both as a topical medication or as a pill, or even as an IV medication. Those work probably by a few mechanisms. Mostly they fight bacteria, but also they reduce the inflammation in the body. And then we have specific anti-inflammatory medication. The number one thing that you know about is medications that target that tumor necrosis factor pathway. It's a molecule in our body that really drives so strongly the inflammation in HS that medications have been developed for that. Adalimumab is one of them. Infliximab is another. Those are medications that I'm happy to answer some questions about, but really beyond the scope again. So if we take all this psychosocial aspect, then we take medical care, okay, which we talked about, lifestyle changes, various drugs. Then we look at surgical care, okay, and that's the third part of it. Then you have surgical care, and that can be incision and drainage to just basically pop those boils and try to drain out, okay. One other thing is the deroofing. You may have heard that, or unroofing. That's when we take these tunnels and really slice them open and try to induce healing like that, and remove all the bad tissue. And there's wide excision, meaning we take the whole area out. That's a pretty more, that's a surgery that's a little more toll on your lifestyle and on your body. And then there's some laser treatments as well. So all this is kind of included in that category of surgical. So when you're doing all this, when I talk to that's all part of good care for HS. And good care of your HS means that your wounds will get better. So now I want to switch and talk about to my understanding of how I approach wound care. So when we have this situation where you have this disease, and I think when I talk to patients, and also I go around and meeting, not now in COVID, but when we used to be able to travel around, and when I talk to people with HS, they tell me this kind of picture emerges to me that this disease is kind of like the devil. It's always there, kind of lingering about. Some days it really comes at you. Some days it's not as bad, but it really is like the devil, and it sits inside you, and you kind of have a hard time getting rid of it. And so when I think of that, and then I think of healing, which is on the other side of the spectrum, I think of this heaven, you know, this paradise that we all achieve, which is life without, which we all dream of achieving, which is life without HS. And in between, what can we do? So we have all this care for HS, and hopefully we give some medications to quiet down the disease and make some changes in our lives. And if that doesn't help, then at some point we need to get to a surgery, which a lot of times provides healing for the body for a long time. But in between that, people who are most of their time are stuck in between there, right? So if you had surgery, kind of got rid of the disease, and you're doing well and you don't have exacerbation, you're lucky. But in the meantime, most patients are kind of on some medications, and they have good days and bad days, and kind of stuck in the middle. And those people in the middle really are the best consumer of this fourth pillar of care for HS, according to my paradigm, which is wound care, right? So you get a medication, you went to a doctor, you're still not 100%. You have days where you're leaking, you have days where you have a lot of pain, you have days where, you know, a wound completely opens. And this is the kind of stuff that I'm talking about when I talk about wound care for HS. So it doesn't mean that you have to have a wound, right? Some people do have what we call frank ulcerations. You get big open sores in your skin that can be painful, that can drain, even get infected sometimes. They smell bad, right? But then there are other small tunnels that, well, the tunnels themselves are big, but they open to this small opening in the skin. And that little thing, it doesn't look like a huge wound. And many doctors don't even understand that, let alone the insurance companies. But that little tiny opening can really drain a lot of fluid, which I may refer to as exudate. So that's the fluid that comes out from the wound or from those tunnels that are in your armpit and your groin. And even sometimes just a big boil can just keep draining and draining, even though the doctor drained it once, and then it kind of closes up and starts swelling again and drains again, and you go through that cycle. And the question is, in the meantime, until maybe you're going to get surgery, or maybe you're going to get the best medication that can keep things in control before those inevitable flares, what can we do and what kind of dressings we can use? So now I'm going to go to the second part of my presentation here and talk about types of dressing. There are many types of dressings, and I'm going to speak to you, which I think is what pertains the most for people with HS, is the level of absorption, right? How good is that dressing in absorbing the liquid that comes out when you have a flare, right? So the good news is that you, as most people with HS are relatively young, so you have not had that experience, but a lot of people on the older side get chronic wounds. And so what I do is take care of these people as well. And what I'm going to talk to you about has been really translated from those patients into HS. But it is important to realize that we don't have great data on dressings that are exactly designed for HS. And so that's part of what we're doing. So just keep that in mind, and I'm sure you'll have some questions about it. So I want you to think of a few categories, and I'll describe just broadly the categories. There are many, many brand names for different dressings in the market, and so it'll be hard for me to go over 1,000 different dressings. I'm going to give you 5 or 6 categories that will help you to think about it. So when you talk to your doctor, when you look at the insurance policy and what they cover, you can put them in different buckets. So get your pens ready and be ready to write down those buckets, because that's really what I want you to think about. Think about classes of dressings and how they can help you. So by far, the best absorbent dressings are dressings that we call highly absorbent, okay, or gelling fibers. These dressings are working kind of like a diaper. If any of you seen diaper or these more advanced sanitary products for women, you've seen the commercials maybe for pads for women who have their periods. You've seen pads. those really, they show you in the commercial this kind of blue dye that goes and kind of goes in, and the dressing really takes it in and holds it. And that is that technology is incredible because these dressings are very sophisticated. They have multiple layers. And so once you, the first layers keep kind of the skin dry and keep the exudate or the fluid away from the skin. That is really important because then you don't get irritation. And then the second layer is what they call a dispersion layer. So that layer takes the fluid and really, like small channels in the dressing, disperse it away from the center. Because remember, you have a dressing that's, I don't know, 3 by 3 inches, but you have a tiny little opening that drains a lot. And if the dressing is just going to work for that little area, you're wasting all the absorbent capacity of that dressing. So these smart dressing really can take the fluid and disperse it all the way to the edges of the dressing, and then you can keep that dressing on yourself for a longer time. And then finally, there's a covering part for the dressing. So these, I'm sorry, and the most important layer is right after the dispersion, which is that gelling fiber. So those are special fibers that when they come in contact with fluid from your wound, they turn into a gel. And a gel is a solid, right? So it's not going to go back into your wound. It can't leak. It just becomes like a solid. And when you break those apart, you can see it's kind of like gelatinous material, right? So like a jello, right? So those dressings are the top of the technology that we have right now, and they're just getting better and better in their absorbent capacity, meaning that they can hold on one small dressing, they can have a lot of fluid there. And that's very useful when you have a flare, right? Because that can be some kind of that can be a great way to handle a bad day with a flare. I think I saw a question on this. Was there? I'm sorry, I'm seeing questions popping, yes. But was there? I think somebody said, yeah. What was the question?
Someone was asking specifically about the dressings. Are they dressings that don't pull dried wounds back open?
Yes. So I'll get to that. Well, you say, wait, what? Repeat the question. Sorry, I'm not sure I heard it.
Yeah, sorry, and I believe this person can feel free to correct me, but they were wondering if these dressings are the types that don't pull dried wounds back open, or if you could clarify a little bit about that.
Oh, okay, yeah. So I'll say this. Usually with HS, a lot of times the problem is that we have too much fluid, so they don't get dry. But in general, we don't want wounds to get dry. Dried wounds, and that's a fight, you know, that the wound healing community has been kind of fighting with awareness about wounds in general, is that when wounds get dry, they don't heal as well. So when you see a scab on your wound, that means that you're too late to change the dressing. You have to keep it moist. And so these dressings are really, really good at keeping the environment, what we call moist wound healing. That's that top layer that I kind of skipped over quickly because I didn't think it was relevant, but I'll just say that these type allow for occlusive environment for the dressing. That means that it allows some interchange of oxygen in and out, but it doesn't allow the fluid to evaporate so easily. So that keeps it nice and moist. So the point is, you don't want to get it to scab. You want to keep it nice and moist. There was another question. Yeah.
There was a similar question to that. It was asking to give a name of the highly absorbent dressing as an example.
Yes, so like I said, there's a lot of brands, but I think what you are looking for with this, so okay, there's Exufiber is one of them, Aquacell is one of them. There's yeah, I think those are there's I'm trying to remember the others, but those are the kind of name brands you want to look at because those are the gelling fiber and highly absorbent dressings. And by the way, in the same category, just so we understand, abdominal pads, those big bulky ones, probably absorb just as much, but they're more bulky. So your insurance company may cover that. And that's great when you're at home, but when you're trying to walk about your day, it's not really comfortable to walk around with like a huge thing that's kind of there and kind of sagging. So yeah, so those are some of those dressings. Okay, I'll move to the next one that you probably are more familiar with. That's the calcium alginate dressing. those calcium alginate dressing. And what I'll do is at the end of this, maybe I'll put some names of brands, because I don't want to, I didn't realize usually these talks we're not allowed to mention brands. So so I'll be able to maybe send a list of some products, and then we can put them on the Facebook channel. So something to wait for. I'll send a more organized list because I don't want to be haphazard. But basically, these are the ones that you probably have gotten from your insurance company. That takes advantage of this alginate, which it's derived from seaweed, the classic one. And so that allows for the dressing to really absorb a lot. The problem that I see with that, and I'll give you some solutions in a minute, is that if you use that, when you get a lot of exudate, they kind of break down. And so they break down into the wound. The other dressings that I mentioned, these gelling fibers that I mentioned and the highly absorbent dressing, those ones don't break and they have that advantage. However, they're more expensive. And so you are unlikely to see it covered by your insurance any day soon. But in my experience, a lot of insurances like to cover these calcium alginate as the most absorbent one that they can afford. So what can we do to help that? And if it's a problem for you, please say yes on the chat. So I know I'm speaking to an audience on the same level. But my patients don't like it because it breaks down and starts getting into the holes of the tunnels. And so, you know, you spend a lot of time trying to take it out. And if it dries like the other person was asking, then it's even more painful. And so they avoid using it altogether. So one trick that I have is, again, it's everything in wound care is pricey, but there are dressings which is the least absorbent. They're called contact layer. The classic name, I'll just say it here, is Mepitel. That's a classic. Adaptic is another one. Those are basically inert mesh that's very thin and can sit on your skin, and they are that contact layer that prevents the alginate from sticking into the wound itself. And so what you can do is when the dressing, the calcium alginate, basically any other dressing, gets overwhelmed with fluid, you just remove that, leave the contact layer, and it can stay there for a couple of days easy, and then just replace that. So it's kind of a barrier between you and the dressing, between your skin and the dressing, to reduce irritation, and it's really good. Challenge again is getting that dressing covered. Excuse me. Okay, the other category, so we talked about highly absorptive gelling fibers, we talked about calcium alginate. Those are the buckets that we're talking about. The next one in order of absorbance is the foam dressing. Those are the ones that are the most covered by insurance companies, probably the ones that you will get if you have any coverage. And then Mepilex is one of the name brands that is known, but there's many other foams around. And those are good dressings for moderate exudate, for moderate drainage. So if you get those dressings, don't get rid of them so quickly. You know, keep it for a rainy day because they're good. They're somewhere in the middle, and they provide good environment for the wound. Remember, we talked about moist wound healing, so they're really good like that. Okay, and the other category are hydrocolloid. Those I'm not really using a lot in HS. Those are rare. I rarely use them. One of the name brands is Duoderm. And those dressings are really good for superficial kind of erosions that you get. And they sit on the skin for a long time. They can sit on 4 or 5 days and don't need to be changed as long as there's not a lot of exudate, because they're not really good at absorbing exudate, but they're really good at protecting. Okay. The other category that I want to talk about is just simple gauzes. Those are the ones that are easy to find. They're the cheapest. And even though they don't absorb a lot and they get stuck in the wounds and kind of, you know, painful when you change them, you know, if that's what you got to play with it. So you want to try to get the non-adherent one, the ones that don't stick, the non-stick gauze. And those sometimes are called Telfa because that was the main name, the first name brand, or the more known name brand, Telfa. Those dressings, you know, what I tell patients, you got to double or triple up on them. And then if you use that contact layer I mentioned, Adaptic, Mepitel, those as the first line of defense, then you may reduce the irritation. But those dressings, unlike all the other dressings I mentioned so far, are really low technology because the fluid gets absorbed, and then the dressing gives it right back into your skin every time you put down your arm, you squeeze on it, or you walk, and that really it's not a good solution for most of the patients, but I do know that you guys get it covered. So one way to address it is to use that contact layer. That's kind of the order of absorbents. The last bucket I'm going to talk about is hydrogel dressing. Those are not super absorbent at all, but what they have is this gel in them that is really soothing and cooling. And so when you get that, what we call inflammatory nodule, that red boil that doesn't want to go away, sometimes patients tell us that that helps. This is really, if you have a great insurance that will cover those are called hydrogels. They're really nice. And that's the last category. So we covered highly absorbent, gelling fibers, calcium alginate, foam dressings, and then hydrocolloid and gauze. And then we talked about hydrogel that I like to use mostly for pain. And the one tip I gave you, which is another category of dressing, is contact layers. These inert meshes, brand name Mepitel, Adaptic is another one that can sit there. They don't absorb, they just protect your skin. Okay, so that, there's a couple other tips I want to throw out there. You know, when you see dressings, they can have antimicrobial stuff kind of, or like antibiotics sort of material put into them. The most common one is silver. You may have seen dressings that are marked with the letter AG. That stands for silver. And silver is just a very good antibiotic kind of material. So when bacteria come in contact with this, also some viruses and fungi, it really can kill them. And so that's why silver for generations have been used as the main one, and they weave it into the dressing. And so you may see a dressing called, I don't know, let's say Mepilex, and then it will say Mepilex AG, or Aquacel, and it will say Aquacel AG. Those have silver in it, and sometimes we use it in areas that we think, oh, this may get infected or it looks infected. So it's a nice thing to have, but it's not necessary, for example, if you use topical antibiotics. So just so you're more educated. Silver is not the only one. There are copper dressings. There are the green dressings that are going around. They use a slightly different technology, but they have something called a molecule called DAC, D-A-C-C. Those green dressings are also antimicrobial. People use honey, which is also, the honey dressings are also acceptable for that. And so there's iodine, providine. You've seen those purple dressing as well. So they tend to have other colors to suggest that they're anti-inflammatory, antimicrobial or against bacteria. But just realize that, there's no evidence to suggest that silver is better than copper, is better than DAC, or like the green, the purple, the orange, or whatever color they are. Whatever your insurance covers right now, the way the evidence is, it's probably the same. Okay. All right. So then,
sorry to interrupt, Dr. Lev-Tov.
Yeah.
There was one question. Can you shower with the mesh?
So I would say that probably not aggressively get it wet, but I wouldn't recommend that. I would recommend sponge bathing around it. So it's in the armpit, and you can protect it from water showering on it. But every person is a little different. So for most people, it can hold if they take a shower, but I wouldn't like hose it down, because then it's going to fall. It has glue on it a little bit that helps to keep it stuck there. Okay. I think I'm pretty much done. The only, I want to say two things, and then we'll turn to questions. Okay. So the one thing I want to say is, insurance companies in the US have a hard time with this. A lot of them ask you to fill out forms that go by area, but area is not necessarily reflecting what you need. So you really got to talk to your dermatologist or the person ordering this and tell them to look not just at the opening, but look at the entire area where the disease is. If your entire armpit is inflamed, but only small area opens, I mean, it just makes sense. They need dressing for the whole area. So just keep that in mind. And what you also want to do is work with a wound care center. So you got to say, I have an open wound and I need a wound care center, because most dermatologists, or any doctor for that matter, they don't know how to order dressings. They're not good at it. That's not what they do every day. But wound care centers do that on a daily basis, and they'll be your best ally for that. So contact a wound care center to help you with that. And the last plug I want to say is for the HS Foundation. and to let you know that the HS Foundation is really now opening up to patients to get involved with committees. So if you want to get involved, just go to the HS Foundation website, and I'm happy to field the questions about that in a minute. All right, I said I'm going to talk for 15 minutes, but like most doctors, I just doubled that, I'm realizing. So I'll stop here, and I'll take questions.
Yes, Dr. Lev-Tov, we have a question from the beginning of your talk. Someone asked, is there any literature or data linking HS to psychology or mental conditions such as depression or anxiety?
I'm sorry, I was breaking up a bit. Linking, let's see.
Linking depression or anxiety with HS.
Oh, okay. Yeah, so so there's a strong association, and probably the main the direction of that. So when we talk about association, you know, we say that A is associated with B, but it doesn't necessarily mean that A causes B or B causes A. So that we call that the direction of the association. So probably in HS, the disease itself causes the psychological comorbidities, the depression or anxiety. And it's not just the fact that you're bummed about the way you look, okay? It's not just being bummed about maybe the way you perceive yourself as smelling, which, by the way, we don't have an objective way, so we don't really know if you smell, but if you feel that you're smelly, then that's it, it doesn't matter. And all these things that you feel about yourself is one thing, and probably the main driver, but actually inflammation in the body itself can affect depression. And so there's some people who even claim that you can use adalimumab or Humira, infliximab, Remicade, those medications that take down the inflammation to help psychologically. So I hope that answered that question.
Someone else asks, what do you recommend for people with very sensitive skin? Tapes and adhesive end up causing a reaction that becomes inflamed, itchy, and painful within a week after small surgeries.
Wonderful question. And that's really important question. So first of all, to the extent possible, what you want to do is avoid the tapes touching the skin. So you want to tape dressing to dressing. And that sometimes means getting creative with how you apply the dressing and using these what we call curlics, so these gauze bandages that kind of stretch long to wrap around the areas. And if you do it like that, it's a bit clumsy, or I'd say a bit bulky, but it's going to avoid your getting in touch with the skin. The other thing is there are some better tapes out there that at least claim to have silicone and be a little more sensitive. So you can look for that. Again, no great evidence on that. And finally, what you can do is if you get inflamed around the wound, you know, you can probably take a break from the dressing and use anti-inflammatory cream like hydrocortisone 1% you can get over the counter to calm down the inflammation. Okay, so between all these, what I want you to realize is when you get that inflammatory reaction, that irritation, trying to soap it strong and trying to rub it off is not going to work. It's going to only make it worse. Okay, you want to keep it clean, but you don't want to use too much soap and certainly not harsh soap. And you want to just dab the area dry and not rub it, and then use maybe a little anti-inflammatory on the breaks that you take.
And then can you clarify what do you mean when you have to be dry?
What did you have to what?
What does it mean when you have to be very dry?
I'm not sure. When did I say that? In what context?
Or maybe the person who sent that in can clarify that question. I'm not sure.
So I see a question here about pomegranate dressing. So those are they have good absorption, but those are really slightly different category. They are supposed to, as the name says, promote granulation. So those class of dressings are really, we're not going to talk about them today because I don't think that they really are really relevant to HS. If you, you know, they're more for chronic wounds. Thankfully, in HS, there's not a major problem in developing granulation tissue. What is granulation tissue? That's that part of the skin right under the skin as the wound healed. You see that red, beefy looking, very vascular, full with blood vessels that is kind of growing, and that's good. That's good for wounds. And in HS, it's usually not a problem. The skin granulates very easily. So I don't tend to use that a lot. If you got it, it's a nice, it can absorb, but it's not my go-to. It's more expensive, so I would focus on other things. What do you recommend washing the wounds with? So without getting too specific, I'd say that generally speaking in HS, just soap and water is fine. I recommend gentle soaps like Dove and the other ones in those categories because they maintain a good pH for the skin around the wound. The wound itself doesn't need a soap necessarily, you know, and I'll stop there because it can get a little complicated, and I don't want to give specific advice on that, but you definitely don't need to rub peroxide on every square inch of your skin or wherever there's wound all the time. That's one of the common things I'm hearing, or alcohol. Just regular soap and water is the easiest, and that will help to do that. Do you know what the pads that come with Hydroware are made out of? No, I do not specifically. To my knowledge, there's two advantages in first, the disclosure. I do know the people. I have no conflict of interest with this company, but I do know the founder, who's an HS patient. So that product is actually good for the question about tape. So this way you don't need tape. So you may want to try that. Again, the burden of evidence is on them to provide you evidence that they actually work better. But one of the advantages, you can insert whatever dressing that you want in there. To my knowledge, I've never really played with that one. So you can choose the one for the day you're having and maybe put it there. And I think they may even offer more than one dressing. To my knowledge, and I could be wrong, I think it's a foam dressing. But now I give you a vocabulary, so you can ask them or even go to their website and look, right? So you got to ask them, is this a gelling fiber? Is it a foam? Is it just a plain woven gauze, right? So you have that vocabulary. Okay, so yeah, so there's a question about Hydroware a lot. So yeah, again, I don't have specific experience with that. They need to provide data, but maybe we should tell them to do research. They can come to University of Miami. Is Hibiclens good for cleansing? Yes. Usually it doesn't burn and not too harsh, so that's fine. The only thing is if you get, some of my patients get wounds behind their ears, and so I wouldn't use it around the ears. There is some evidence that suggests that it can be poisonous to the ears. So just keep it away from your ears. Will this session be available after recording? I don't know. My treatment plan is gauze, Yankee solution, and that's all. Is that sufficient? If it works for you, yes. Which leads me to, I think those are all the questions. So which leads me to the next point. Where are we going forward with this? So we've done a study where we gave people with HS dressings, and we said, tell us which one is the best, right? It's common sense dressing. And the responses were all over the place. People said, oh, this one's good, or said, no, this one's bad. Wherever people thought it hurts, they said, oh, no, it doesn't hurt. And so what we are designing now, and we're in the final steps of analyzing the data, is a whole new concept that we call kind of like a HS package. So the concept says that you will get the three categories of dressing. You're going to get a bunch of them, and then you will use them for 2-3 weeks, and then you'll come back to your doctor and say, these are the dressings that works the best. This is what I need. And then we try to measure the effect of that on the disease, and more importantly, on the quality of life. So more to come on that, but that's kind of what we're trying to do. We're also trying to do some research with post-surgical wounds, which I didn't touch about too much, but more data will come on that. I think there was another question. I didn't catch it. What is poisonous to the ears? The Hibiclens. So yeah, so it could be. So just don't clean around the ears with them.
We have one question again in our Q&A box. She says, I stay dry. Is that good?
Say that again. What? It
says, I stay dry. Is that good? And I'm assuming maybe she's referring to wounds.
I'm sorry. For some reason, you're breaking up. Maybe you can copy and paste it into the chat. I'll read it, or repeat it slowly.
So the question is, this person it seems like they allow their wounds to dry out. Is that a good thing?
So generally speaking, in wound care in general, if you have a wound that you want it to heal, it's like the Goldilocks rules. Not too much, not too little. You want to keep the wound moist. So if a scab forms, it's usually not good, because think about your skin cells, right? You have a break in the skin, and your skin cells are trying to crawl over and fill in that gap. But if you have a dry scab there right in the middle, they have to burrow under it and try to break it down, and that takes longer. Plus, when you have a scab and then you remove it, it's very painful. So, so you don't want a scab to form. On the other hand, if it's too wet, which is usually the case in HS, so usually it's not an issue of getting too dry. The issue is how to keep it from getting too wet. So for that, it's not good too much because it's irritating to the skin around, and too much fluid just doesn't allow for healing. But your skin, when you grow skin in the lab, you put it in a liquid, right? So if you look, you have these petri dishes where there's fluid in it, and the skin grows just fine. It doesn't mature well, but it grows just fine. So if you have too much fluid, it wouldn't be bad for wound healing necessarily, but it could be bad for the skin around it. So the short answer is you want to have just right. You want to get it nice and moist. I call this ooey gooey healing. You want to just kind of ooey gooey. It's okay. It doesn't look great, but it heals the best. What options do we have for smelly wounds? Okay, good. Very good question. So disclaimer again, most of the data we have is from wounds in general, not from HS wounds. And then that data is pretty crappy because, as I said before, we don't have an objective way to measure smell, right? So there's no machine. When you have a temperature, you put a thermometer in your mouth and it tells you high, low, and exactly the number. But we don't have that kind of thermometer for smell where you go into a room or put something in a wound and it tells you this wound is smelly, right? What do we rely on? We rely on our objective feeling of smelling and saying, is it good or not? And I can tell you, and maybe my wife will testify, that I have a pretty crappy nose. I don't smell, I can't pick up smells. So to me, it never bothers me. So with that disclaimer in mind, there are some things that have been used. There are dressings that have charcoal in them that is used sometimes. There is evidence that using medication by prescription called Metro Cream is also good. That's a metronidazole, probably because it reduces the bacterial component. And again, that is probably true for other dressings that are antimicrobial, because usually the smell comes from certain type of bacteria that grow in the wound. So you want to treat that. But by far, the best treatment for smell is to get your disease under control. Because when you don't have open sores on your skin, then you're less likely to have bad exudate that sits in the armpit or the groin and stay there forever and start growing bacteria and developing that smell. So hopefully I answered that question. Keep it just dry enough, but not too wet, not too dry. You can ask your doctor about charcoal dressing, about metronidazole cream, if it works for you. Those kind of things can help. Any other questions? All righty, folks. If questions come up later, please don't hesitate to write. And I'm sure Angela or the other organizers can send that to me, and I'll be happy to answer. And again, go on to the HS Foundation website. We have a lot of resources, and we're in the works of developing more wound care type resources. We are doing, very soon, we'll have an event called HS Expo for patients where we'll talk about wounds for sure. And every year we have the HS meeting where we have a wound care workshop. So I see a couple last minute questions coming in. Okay, let's see. We have here, when your boil burst and leave a deep hole, what do you recommend? Well, I recommend going to your doctor. It depends on the amount of drainage. That's the kind of dressing you're going to use, as we discussed. But really, when it develops a deep hole, it could mean so many different things. Maybe a new tunnel is forming. Maybe your disease is worsening. You need better care. Maybe a simple surgery will help there. Maybe that tunnel, depending on where it is, can connect. Some people, in worst case scenario, the tunnel bursts down and connects to their gut and stuff if it happens on their buttock area. So really, you want to put a good absorptive dressing and then ask your doctor next how often one has to change dressing. Great question. It depends on the amount of drainage, right? So when you look at your dressing, take a peek and see, is it overwhelmed? If it's not overwhelmed, meaning it's not soaking wet. It's not. It doesn't have that stain of the exudate all over it. Then it's probably still good to go. And that speaks to the better dressing. These better dressings that are multi-layer can last longer because they disperse the fluid. They can absorb much more than their own weight. So a small molecule can absorb 1,000 times its own weight. So that's why they last longer. So so if you have a better dressing, you don't have to change it as often, given if you have the same amount of exudate, right? So the bottom line here, you look at the dressing. If it's not overwhelmed, you can keep it on. Save your money.
Okay, so I'm going to share. So there are a couple other, a few kind of wrap up questions. Did you see those, Dr. Lev-Tov?
No, I did not. Let me see here in the chat. I think I addressed those. Oh, hold on. Not a tunnel, just a boil that burst. In this case, under the breast, no tunneling. Yeah, so it sounds like using a good dressing, like, well, it depends on the amount of drainage. So if you have a foam, then you can try to use that and see how that goes. If it gets overwhelmed, you need to step it up to something like a gelling fiber or highly absorptive. Yeah. So that's, and again, talk to your doctor, because there could be some things that you can do to avoid getting that, like different bras and such. We generally speaking don't like wires, but my female patients tell me that I don't understand anything about bras because I don't have breasts. So we laugh about it, but I think we've developed some knowledge to say that there are no sports bras that can provide that support without the wires. All right, what should we do for old scars? Well, okay, that's a whole big topic. But I'll just say this, generally speaking, there are a few categories, and it really depends on how big they are, how thick they are. So you can cut them out and put a graft. You can inject them to make them go down. You can laser them. There's many different categories. So in that case, I would go to a plastic surgeon or a cosmetic dermatologist. Unfortunately, all these treatments are out of pocket. And one thing I should say, you should be at least a year out in control of your HS. The last thing you want to do is invest, $10,000 in a surgery and then get a boil that will break everything down. My underwear absorbs the drainage right next to my thigh. Okay, is that okay? Do I also need a dressing? Well, I mean, if it works for you, that's fine. But generally speaking, I would say you need to have, you should have a dressing there. Sounds like. Will having keloid condition impede on the healing of the wound? Okay, a keloid is a scar, so that means by definition there's no wound there. A keloid is a scar gone mad. It just keeps making itself over and over and over again. So that's not something I would. The question is a little doesn't make sense, but keloid is something you want to address. You should not have a wound under it, and it's not a keloid. Any other questions coming in?
Okay, that looks good. So if there are no other questions, we just have a couple wrap-up slides. Okay, so we have, we just want to make everyone aware that if you have had COVID-19 and you have HS or know someone, there is a research project going on. So please go to that website, hscovid.ucsf.edu, and let the researchers know your experience. It's the only way we're going to know if COVID impacts people with HS more or less. And then we always like to wrap up with our thank you. So I want to make sure that we have a thank you to all the volunteers who've worked behind the scenes to make this meeting possible. And also want to directly thank Dr. Lev-Tov for taking time today to talk to us about wound care. We really appreciate your time and your dedication. And finally, we want to thank everyone here in Zoom and online for helping build our community. We have a number of meetings coming up, and we hope to see you at some of our future events. So thank you, and everyone has a good day.
It's my pleasure. Thank you for having me.